Men who can't get hard or can't stay hard are told the same useless advice. Just relax, it's all in your head. Or worse, they immediately reach for a pill without understanding what's actually going wrong inside their body. You see, your erection is a cardiovascular event. It depends on blood flow, pressure, and a set of muscles that 90% of men have never trained a single day in their lives. And the research is clear. In a randomized controlled trial of 55 men, those who trained these muscles correctly saw about 40% fully cured and another 34.5% significantly improved within 6 months. And I need to say this up front. If your ED came on suddenly, is rapidly getting worse, or you're experiencing chest pain or shortness of breath, see a doctor before anything else. Multiple medical guidelines now recognize erectile dysfunction as one of the earliest warning signs of cardiovascular disease. That's not fear-mongering, that's a medical consensus. But before exercises, you need to understand how an erection actually works. Think of your penis like a hydraulic system. Step 1, blood rushes in through your arteries. Step 2, that blood gets trapped under pressure. And step 3, your body has to be in a relaxed state, not overthinking whether it's going to work or not. But here's what most men don't know. There are 2 muscles sitting at the base of your penis. One of them pumps pressure into the erectile chambers. The other one acts like a clamp. It stops blood from leaking back out. When these muscles are weak, blood flows in, but it doesn't stay. That's why some men can get semi-hard, but can't reach or maintain full rigidity. So how do you train them? Imagine you're trying to stop yourself from urinating and passing gas at the same time. That's the contraction. But here's what's critical. Do not squeeze your butt cheeks, do not brace your abs, and do not hold your breath. The researchers specifically instructed men to avoid all 3 because they mean you're activating the wrong muscles. When you're doing it right, you'll see a slight lift at the base of your scrotum and a small retraction at the base of the penis. That's your confirmation. Squeeze as hard as you can. Hold it, release, then rest briefly. Do that 3 times standing and then 3 times sitting. Then 3 times lying on your back with your knees bent. That's 1 session. Then do it again in the evening. The whole thing takes only 2 to 4 minutes per session. Start with 3 to 5 seconds if that's all you can do cleanly, then build toward 8 to 10 seconds over a few weeks. Give it 3 months. That's when the study showed real improvement. But a lot of men noticed morning erections coming back way before that. Now, that's 1/2 of the equation, the muscle side. But remember what I said earlier? Your erection is a hydraulic system. Muscles control the clamp. Blood flow is the fuel. And this is where it gets interesting. The single most studied exercise for erectile dysfunction is not weightlifting. It's cardio. A 2023 meta-analysis published in the Journal of Sexual Medicine pulled together every randomized controlled trial on aerobic exercise and erections. And what surprised even the researchers was this: the worse your ED is, the bigger the benefit. So, what do you actually do? Just walk 5 days a week for 20 to 30 minutes, brisk enough that you can talk in short sentences, but can't sing. Every couple of weeks, add 5 minutes until you're above 150 minutes a week. That's your floor. And option 2. 40 minutes of moderate to vigorous intensity cardio, 4 times a week, 160 minutes total. Cycling, swimming, jogging, rowing, pick something that pushes your heart rate up higher than a walk. Now there's a third factor that connects everything. And if this applies to you, it might be the most important part of this entire video: body fat. Here's why it matters. Fat tissue, especially around your midsection, is not just sitting there. It's metabolically active. It increases inflammation in your blood vessels, it worsens insulin resistance, and it damages the endothelial lining, which is the inner wall of your arteries, the exact tissue responsible for producing nitric oxide and dilating to let blood flow into your penis. And this isn't a theory, it's been tested. A randomized controlled trial published in JAMA by Esposito and colleagues took 110 obese sedentary men with erectile dysfunction. These men didn't have diabetes, they weren't on blood pressure medication, they were simply overweight and inactive. Half were put on a 2-year lifestyle program, structured exercise, and dietary changes. The other half got general information and were left to it. So, the results? The men in the lifestyle group increased their activity to about 195 minutes per week. They lost real weight, and their erection scores climbed from about 13.9 to 17 on clinical scales. And the control group? Almost no change. Only 3 out of 55 controls hit that same benchmark. Now, if you have diabetes or a serious metabolic condition, everything in this video still helps, but work with your doctor because you may need additional treatment. So as I said earlier, cardio is really important for erections. But there's something that makes it work even better. Your body runs on a system. Blood vessels produce nitric oxide to open up and let blood flow in. But that system doesn't work in isolation. It depends on how your body processes sugar, how much inflammation is running through your bloodstream, and how much fat is wrapped around your organs, sending out signals that damage vessel walls. When those things are off, your vessels can't produce enough nitric oxide no matter how much cardio you do. It's like widening a road but filling it with potholes. Traffic still doesn't move. Well, resistance training fixes the road. A 2024 meta-analysis tested this directly. Adding resistance training did not reach statistical significance for erections specifically. But every metabolic problem that resistance training corrects, insulin resistance, excess visceral fat, chronic inflammation, is the same cluster of problems that drove the ED in these trials. So, you're not lifting to fix the erection, you're lifting to fix the body the erection lives in. Here's the workout routine you're gonna do twice a week. You start with goblet squats. Hold a dumbbell at your chest, feet shoulder width, sit your hips back and down until your thighs hit parallel. Drive back up through your whole foot. This one movement works your quads, glutes, and core all at once. And the more muscle mass you activate, the bigger the metabolic impact. Do 2 to 3 sets for 8 to 12 reps. Next up, Romanian deadlifts. So, dumbbells in front of your thighs, soft knee bend that stays locked. Push your hips straight back and let the weight slide down your legs until you feel a deep stretch in your hamstrings. Squeeze your glutes to stand tall. The back stays flat. This targets your entire posterior chain, the biggest muscle group most men completely neglect. And neglected muscles don't burn fuel, and they don't improve insulin response. Same thing, do 2 to 3 sets for 8 to 12. Then push-ups, hands just outside your shoulders, chest to the floor, press back up. If you can't do one from the floor, hands on a bench, hands on a wall, and work your way down. Also 2 to 3 sets, but do it for 8 to 15 reps. Now, pair that with dumbbell rows, one hand and knee on a bench. Pull the weight toward your hip. Squeeze your shoulder blades back at the top, then lower it slowly, without swinging. Same as push-ups, 2 to 3 sets of 8 to 15 per side. And optionally, if you want, try loaded carries. Grab the heaviest dumbbells you can hold, stand tall, and just walk. Your grip will give out before anything else, but that's the point. Aim 2 to 3 sets of this. This is how your workout routine should look. Do it on days you're not doing cardio. But there's one thing that can override all of it. Your brain. Remember what I said at the beginning? Step 3 of the hydraulic system. Your body has to be in a relaxed state. That means your nervous system needs to be in parasympathetic mode. But the moment you start thinking, is it hard enough? Is it going to last? What if it fails again? Your brain flips the switch. You go into sympathetic mode, fight or flight. And in that state, your body redirects blood to your muscles, your heart, your lungs, survival organs, not your penis. Your body literally decides that an erection is not a priority right now. This isn't a weakness, and it isn't in your head. It's the same nervous system response that would save your life if a car was coming at you. It's just firing at the worst possible time. A randomized controlled trial published in the Journal of Sexual Medicine tested a 7-week internet-based cognitive behavioral therapy program on 78 men. Right after the program, there was a small improvement, but at the 6-month follow-up, the effect size jumped to 0.88. That's a large effect in behavioral research. So, what can you do right now without a therapist? First, stop catastrophizing. One bad night is not a diagnosis. Erections fluctuate. Stress, sleep, alcohol, fatigue, all of it affects performance on any given night. The moment you turn one bad experience into a story about being broken, you've activated the exact nervous system response that guarantees it happens again. Second, 60 seconds before intercourse, do a nervous system downshift. Breathe in for 4 seconds, out for 6 to 8. Do that for a minute. You're manually switching your body back into the state where erections work. Third, during intercourse, put your attention on sensation, not monitoring whether it's hard enough, and don't watch yourself from the outside. Feel what's actually happening. The moment you shift from experiencing to evaluating, you've left parasympathetic mode.